Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Breast cyst. This breast cyst can be present in breast and it is most common, especially in the late decade of reproductive life. It is most common. This breast cyst mainly occurs due to the non-integrated involution of the stroma and the epithelium. It occurs due to non integrated involution of stroma and epithelium will result in this breast cyst. If there is a cyst in the breast, the clinical features of the breast cyst are that these breast cysts are most commonly they are multiple, they can be bilateral, and they will mimic the malignancy. These breast cysts will present suddenly, and as a result we should give immediate, when you diagnose it this gives an immediate relief. So the diagnosis of breast cyst is mainly done by aspiration you should do, and you should do an ultrasonography. Then treatment of breast cyst. In the breast cyst the treatment is, if it is there is only one cyst, then we can do aspiration of the solitary cyst can be done. In aspiration of the solitary cyst it will resolve the one cyst which is there. If you aspirate it, it will resolve completely. And then if it is not blood stained, if the cyst is not blood stained, then there is no need to do any further treatment. No further treatment is required if it is not blood stained. Then one important thing is core biopsy or local excision is important. In core biopsy or local excision is important, especially if there is any residual lump, or if the fluid is blood stained, or for histological diagnosis. In these cases we should do a core biopsy and local excision is required.
thank you and thank you for watching.